Hello everyone, welcome back to Mira Ahmed. Today we are going to discuss what are the points that we should look at while we are checking or examining a chest x-ray, plain chest x-ray. So usually I like to summarize them in the mnemonic ABCD. So let us start with A. First, when we are talking about A, let us talk about the airway. The airway, if you are going to talk about it here, it is represented by the centrally located trachea. So this is here, trachea, which will appear as a tube translucent in color. So translucent in color means it is dark gray because it contains gas, obviously. So this is a trachea. Okay, if I went down with the trachea, I'll find it is at the level of T4. It is bifurcated into the two main bronchi, right main bronchus and the left main bronchus. And this is usually, this point of bifurcation is called carina. So this is the first part of my airway. Second part of my airway is the lungs. The lungs are located to the periphery. So all that is here, this is the left lung and this is the right lung. Now, what I should look at to any organ which is bilateral, I mean has two copies, right and left, always compare whatever in the left with whatever in the right and vice versa. In a normal chest x-ray, usually how the lung is appearing as dark gray to black because there's a huge amount of air inside, but still it can and we can see trace in it some sort of what we call it these white dots, okay, here and there, which we call it bronchovascular markings. These bronchovascular markings is the bronchial tree, which are like divided into smaller parts with the blood vessels that are also divided into smaller parts. The normal appearance of lung in chest x-ray, this bronchovascular marking shouldn't be detected by your gross eye or naked eye after or beyond the medial two-thirds of the lung. So if this is the lung field, the medial two-thirds of the field of the lung will end here. So actually, if you compared whatever you can see here with here, you will find the more peripheral you go, the less marking you get. You can view it on that chest x-ray also. You can see it here very apparent, very prominent near the hilum, and here slightly a little bit is like lines going, okay, to the periphery. But if you came here, it is less visible. Less visible not because there is no bronchovascular marking, there is, but they are very minute to be detected by your naked eyes. Okay, so this is regarding the airway. Of course, for the trachea, it should be central with slight tilt to the right, as you see here. If it is extremely shifted, whether extremely to the right or extremely to the left, this is abnormality. We'll discuss later. The following point is B. B here, what we need to know about B is ultimately are the bones and the breast if the patient is female. So now what are the bones that we should look at in the chest x-ray, normal chest x-ray? Of course, we can detect that those are the clavicles and these are the scapulae on each side, okay, and those are our ribs, the posterior ends of the ribs, okay. And then after that we can identify also the vertebral column, the vertebrae. As you see, these are the vertebrae. This is a transverse process. Here we can identify and so on. So usually the bones is appearing from light, very light gray in color in the chest x-ray to white, especially here, because here there is overlap between the vertebra and the heart with its own filled chambers of blood. So wherever you have overlapping tissues, you will have more bright white appearance. So this is regarding the bones. So A is airway, trachea and lung. B is bones and breast. In case of female breast, we can identify here a soft tissue shadow, which is appearing again light gray to white, okay, on each side. And we shouldn't misdiagnose this as masses. First of all, because you have to be sure from the patient data while you are examining the chest x-ray, and also it is bilateral. So obviously this is a soft shadow of female breast. So always when you look to the bone, okay, make sure that there is no soft, or there is, whether there is or there isn't, a soft tissue shadow of the female breast. So this is regarding B. Regarding C, if you are going to talk about what is represented by the letter C, is the cardiac shadow. Cardiac shadow needs sessions of explanations, but at least now we can recognize that the cardiac shadow is located more or less in the center of the image, chest x-ray image. But if you are going to talk about the percentage of the heart, which percentage is looking right and which percentage is looking left, around the midline, you will find nearly 1/3 of the heart is located to the right and 2/3 are located to the left. And here I'm talking about the posterior anterior view chest x-ray in a normal patient. So this is regarding the heart. It is appearing from light gray to white. And of course, the brightness is increased here because the overlap between the heart and the vertebrae. Lastly, D, when we are talking about D, D is representing the diaphragm. The diaphragm here has two parts or two copulae. The right copula to the right side and the left copula to the left side. And if you compare between both of them, you will find the level of the right copula is a bit higher than the left. Why? Because the push up of the liver. So this here is liver shadow. Similarly, in the female x-ray, this one, you can see that this is the right copula of the diaphragm and this is the left copula of the diaphragm. Most of the time, underneath the left copula of the diaphragm, you might see air bubbles, which is appearing dark gray to black, this one, which is called gastric gas. So the right copula is always higher than the left. Because of the liver, the left in most cases is underneath of it is gas bubbles of the stomach. So please, in case of female chest x-ray, don't get confused between the soft shadow of the diaphragmatic copula and the soft shadow, tissue shadow of the female breast. These two you have to differentiate on a chest x-ray. Thank you.